TV6 News.
About 6 months ago, Hammond-Henry Hospital opened a chiropractic clinic right inside the hospital, and now they've added another doctor and expanded offerings. Dr. Allison David is here to tell us more about the clinic. It is one of the few inside a hospital in the state of Illinois.
Yes,
Thanks for coming in.
Thank you,
And you
Marsha.
go by Allie,
Yep.
so we'll call you Allie.
Yep.
Aside from the chiropractic care, you are also offering what's called dry needling, and so I want to learn more about that. So explain what is dry needling.
Yes, so dry needling, it's an emerging technique in sports medicine and manual therapy. All it really is an insertion of a really fine needle into sites of muscular tightness within somebody's body. Oftentimes you might hear us call it trigger points that we find within the muscles themselves. And yeah, it's growing.
How is that different than acupuncture then?
So the biggest difference is the lens that the clinician looks through. So my lens is more through the musculoskeletal system, looking where the tissue feels tight, where I find tension points within the body. That's the biggest difference.
And so then what do the needles do, or what are they supposed to do?
So they're supposed to get into the adhesion or the trigger point to help break up kind of that pain spasm cycle that our patients are going through in both an acute and a chronic setting. So it's a really cool tool.
Yeah, so when you're having like muscular pain, you almost feel like there's a knot there.
Yes.
So that's what you're kind of focusing on?
Yeah, so actually dry needling is kind of based on ashi acupuncture, which translates to, oh yes, that's the spot. So exactly, yep.
And so is there any clinical evidence that this helps alleviate pain and break up that tightness?
Yeah, so it's emerging, so the research is building and growing every day. I started using it at UW-Madison, a big R1 university where we did lots of research with it with our Badger athletes. But yes, it's growing every day for both the acute injuries and the chronic, like low back pain, neck pain that people have had for a long time.
Yeah. Let's talk a little bit about some of the other services that you provide at the clinic. You kind of have a focus on treating athletes and sports medicine?
Yes, yes. As an athletic trainer, that was my first medical degree and something that I have a strong passion in, so I love helping athletes get out onto the field quicker and safer as well. Yep, so I use a variety of different things on top of the dry needling. The adjustments, of course, from a chiropractor, as well as myofascial decompression or cupping you might have heard of, muscle scraping, pin and stretch techniques, and then I do a fair amount of corrective exercises too with my patients.
Kind of whatever it takes.
Yes, yes. I try to
work.
build up my toolbox to meet the person where they're at, exactly.
And if someone asked you, how is that different from, let's say, a physical therapist?
We're very, very similar, honestly. I would like to think that the chiropractor kind of is that initial, we try to get the pain down for our patients, and then the physical therapist comes in afterwards to kind of build up strength, stability, give the patient more attention over time, and we're kind of there for that initial injury, insult, and things like that.
Yeah, so you do it kind of from start to finish. So what do you think about being in a hospital setting?
Oh, it's been incredible. Yes.
Yeah.
Yes, it's been awesome to have those providers right alongside us, have our backs for different things. To just have the resources and the supply around you, it's been really amazing.
All right.
Yeah.
Well, we appreciate you coming in and telling us about the services that you're offering.
Thank you so much.
Dr. Allie David with Hammond-Henry Hospital.
Thank you.
In Geneseo. All right, coming up in our